Hello, I'm Dr. Bethany Murray. I'm a faculty member of the IU School of Medicine on the Bloomington campus. And today I'm going to be demonstrating draping and positioning of the patient for your physical exam. Let's start off with some basics. First of all, you should check yourself and see if you are prepared to do a physical exam. Notice that whenever I lean over the patient with my stethoscope, it can dangle on them and potentially fall on them. So at this point, I want to put my stethoscope aside until it's needed. Are there any other items on my body that might fall onto the patient or make this uncomfortable for him or her? Women and men should also assess the length of their hair. My hair is a little bit long for doing a physical exam. When I'm turning the patient from side to side, my hair could easily fall into their face. Or, should they have any kind of an open wound, I could contaminate the surface with my hair. So anyone who has hair beneath about chin length should have some method of securing their hair during patient care. Okay, now I think I'm ready to begin. So what we're going to talk about today is draping and positioning the patient. Draping is a term that refers to uncovering only the parts of the patient that you want to examine. The purpose of this is for privacy of the patient, modesty concerns, and comfort and safety concerns. I like to think of draping in this way. Imagine that you are doing your physical exam in a snowstorm or a very cold area. How much skin would you want to have exposed in a very cold environment? As little as possible, right? So that's the technique that we're going to be practicing today. We also want to talk about positioning your patient for the physical exam. This is both to optimize comfort for the patient as well as improve your physical exam findings. Okay, let us begin. Typically, when you're examining the head of the patient, it's best to have them sitting on the side of the bed. In this case, since I'm using a mannequin, I'll leave the patient lying flat. Now you may notice as I do the physical exam, I'm leaning over at the waist, and this is going to become uncomfortable for my back very quickly. The taller you are as a physician or student, the more uncomfortable this is going to become. So I'm going to raise the head of the bed up to a level that's more comfortable for me. There, I think that's okay. Maybe just a little bit more. Now I can easily move around the patient without straining myself or harming myself in the process. So when we're doing the physical exam of the patient's head, there's not a lot of positioning or draping to be concerned about. As we move down the body, we're going to be looking and examining the chest of the patient and then the back of the patient, okay? So, of course, each step of the way, you have advised the patient as to what you're going to examine. I'd like to look at your chest now and gotten their permission. Is that okay? Okay? So this is going to necessitate exposing skin. Never do your physical exam over clothing. Clothing can rattle and make sounds and trick your ear into thinking that there are abnormal findings when there are not. Okay, so in order to examine your chest, I need to lower the sheet down to about your waist. Is that okay? All right, so you're going to take this to right at the costal margin and keep the abdomen covered at this point. All right? You'll notice the patient has a gown on, so we need to untie your gown and lower that down. Is that okay as well? You just simply reach behind the patient, untie the gown. Uh-oh, they've tied it at the waist. Now we're going to need to turn you over in bed to get your gown untied at the waist. So let's raise this back up for comfort, and we're going to turn the patient towards me. I don't want to turn them away from me and have them go rolling off the side of the bed. Okay? Neither do I want them to lose control and come rolling out of the bed onto me. So I'm going to go ahead and put the side rail up so it's nice and secure. Okay? In order to turn you, Mr. Smith, we need to lay one arm up here, and we're going to go ahead and bend one knee up here as well. Okay? And then with your left hand behind your patient's shoulder and your right hand behind their knee, you can just gently roll them onto their side. And if Mr. Smith is conscious, you can ask him to hold on to the side rail. There we go. Now let's untie the gown and pull it a little bit out of the way. Okay, Mr. Smith, I'm going to gently lower you back onto your back. Let's make sure that there are no tubes or wrinkles that are going to be uncomfortable. All right, how's that feel? Okay, so now we're going to get on to that chest examination. Feel free to lower the side rail back down if you want better access to the patient. Just remember, before you move them or leave the room, you need to raise the side rails back up. Okay, the side rail on that side of the bed is currently down for demonstration purposes. So Mr. Smith, I'm going to lower your gown to about your abdominal area, about where the rib cage is. And then we're going to go ahead and lower the rest of the gown. Okay, it looks like I need to unsnap your Most hospital gowns now come with easy-to-do snaps in order to be able to maneuver IV lines and other ports that might be necessary for patient care. Okay? So now we can just lower this down. Mr. Smith might be cold, and at which point, as you do other things, obtain your supplies and so forth, don't forget to cover him back up. So I'm going to lower back down. If you are in a clinical setting, in an academic setting, your standardized patients will be wearing a sports bra or some type of undergarment apparel. Okay? So now we can freely inspect the chest. We can palpate the chest. We can auscultate the chest with our stethoscope. Okay? All right, so we're finished with the chest. Now I think, Mr. Smith, I'd like to move down to examining your abdomen before we look at your back. Is that okay? All right, so let's raise this back up. And now you're using the patient's gown as a blanket. You want to just lower this down. And pull the gown up. Okay? All right, and I'm going to pull it about that same costal margin that I did for the upper chest wall. Now, the pajama bottoms are tied a little bit high, so Mr. Smith, I need to lower these. I'm not going to take these all the way down, but I need to lower them just a little bit so I can access your full abdomen. All right, so let's untie that. There's his umbilicus, and we're going to go right to the suprapubic area. Okay, we don't really need to go any further. The abdominal exam is completed in a rectangle about this size, so we can just stop here. Now I can freely visualize the abdomen, percuss the abdomen, and palpate the abdomen. Okay, so we're finished with your abdominal exam. Let's retie your pajamas. Make sure that they're snug enough that when you get onto the gait and balance assessment for a conscious patient, that his pajamas don't fall to the ground. Okay. Now I need to listen to and inspect your back. So we're going to follow the same procedure we did for the gown. Put the side rail up. Left arm across the chest, left knee up. I put my hand behind my patient's shoulders, and then I gently roll to the side. It's okay to take an added precaution if your bed has this, of putting up a foot rail. Okay? Now if you could just go ahead and hold on to the rail, maybe we can scoot you back a little bit. Okay. And now, I can walk around the side of the bed, assess the patient's upper torso and in the back, or the back region, auscultate, percuss, do the procedures that I need to do. Obviously, with an unconscious patient, this would be a little safer and a little easier to accomplish if you have a partner. Okay, let's cover everything back up. Good job. Are you warm enough? Okay, great. Now we're going to move on. For first-year medical students, we don't examine the genitalia region. If you were considering draping for a genital or rectal exam, then you would want to move that up from the bottom. You'd want to bring up your blanket or sheet, exposing just right here to the level of the genitals, and then using these stirrups on the exam bed, or simply inserting a Foley catheter is a good example. You have the patient bend their knees at this point, and then you can have access to the genital region. Obviously, you're going to need to take off the pajama pants first, okay? All right, and then lastly, if we want to think about draping for the extremities, we just want to uncover one extremity at a time. So I'm going to check your right arm. I'm going to bring it out. You know, maybe I'm going to be checking for passive range of motion. Maybe I'm measuring brachial artery and radial artery. Maybe I'm doing a blood pressure reading. Maybe I need to do some reflex assessments. Okay? When that arm's finished, you cover it back up. Then you would uncover the other arm and do your assessment. And then we're going to do the same thing with the legs. Cover one leg at a time. We're going to do some passive range of motion here. We're going to feel for his popliteal pulse, his posterior tibial pulse, his dorsalis pedis pulse. We're going to do a little reflex, patellar reflex here. Okay, maybe an Achilles reflex. Okay, whatever assessment we need to do. And then cover that back up. And then repeat for the other side. Okay? So these are the basics of draping the patient. There is an alternative method you can use if the patient does not have a gown or the gown is not warm enough. You can use a two-sheet method. With the two-sheet method, you're basically using a top sheet and a bottom sheet, and that provides double thickness for the patient. So you can move the sheets down and up. To expose the abdomen, you would move this up, this one down, okay, and so forth. Always remember, though, to keep your patient covered. Don't walk away from the bed with them uncovered. Now, we've addressed positioning a little bit as far as turning your patient in the bed for a person who is non-ambulatory. Let's also talk about positioning for the physical exam. Okay, so this bed is completely flat and is pretty uncomfortable. Most people can't tolerate a completely flat bed. So what you want to do is raise the head of the bed 30 degrees, which is about right here, okay? For foundations of clinical practice, all exams are completed from the left side of the patient. The right side of the patient. Okay? All exams are completed from the right side of the patient. We'll be inspecting the right jugular vein above the right atrium of the heart. Okay? We'll be inspecting the abdomen from the right side, palpating the liver from the right side, and then reaching over to palpate the spleen. Okay? So all of our exam is done from the right side of the patient with the head of the bed at 30 degrees. When you're ready to do an abdominal exam, it's more comfortable for the patient to have their knees slightly bent. And if they can tolerate it, go ahead and lower the head back down a little bit. This allows the abdomen to be presented to you in a flat and relaxed manner. The bent knees help to relax the abdomen, and this will get you a better exam. Okay? Don't forget, if you're doing this exam on an exam table as opposed to a hospital bed, there will be an extension off the base of the exam table. Most of our OSCE rooms use exam tables, and you will definitely need to pull out that extension when you have your patient lie down. They need to have their feet and legs supported by a bed, cot, or an extension, and not just be dangling. Okay, that concludes the basics of draping and positioning your patient. Always remember, privacy, modesty, and comfort and safety. Those are the 4 hallmarks of proper draping. Positioning the patient is both for your comfort, raising the bed up to a comfortable height. Before you leave the room, make sure you have brought the side rails back up, foot rails back down. In a hospital setting, having all 4 side rails up constitutes an unsafe environment for the patient. A confused person may attempt to climb out of bed over the side rails and may fall. So you want to make sure you have your front side rails, head side rails up, and the bed returned to the low position for the patient's comfort when they need to get out of the bed. Okay, thank you very much. I appreciate your time and your attention.